All right. Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, why don't you tell them what's on the agenda for today, Heather?
I'm excited that we're bringing on another company and a person representing that company that talks about maternal health. This is becoming a very big theme here. So we have Dr. Isabel Fulcher, who we call Izzy. She's a statistician. Big words don't always work.
Lots of syllables.
Yeah, Izzy is a statistician passionate about developing data-driven solutions to the maternal health crisis in the United States. As chief scientific officer and co-founder at Delfina, she leads a team that develops, validates, and evaluates predictive algorithms to improve pregnancy care. Izzy has a PhD in biostatistics and was formerly a postdoctoral fellow at the Harvard Data Science Initiative. Yet again, we have another very brilliant person in our universe.
It just keeps getting smarter around here.
I know, and I can't even say statistician.
That's why we're just the interviewers and not the interviewees.
Exactly. Usually good at talking.
Usually. Me good words. Me good words.
So Delfina, this is it.
Oh, all right. So let's get into it then. Here's our conversation with Izzy from Delfina.
Hi, and welcome to Healthcare Uprising. We've got Izzy Fulcher, co-founder and chief scientific officer with Delfina with us today. Welcome to the show, Izzy.
Thanks so much for having me.
Great. Well, as mentioned, you're the chief scientific officer. Not everyone knows what that means, but tell us a little bit about what inspired you to be a part of creating Delfina since you're a co-founder. And
I'm sorry, I hear chief science officer. I think Mr. Spock.
Oh.
Not that cool.
That's my only reference.
Oh gosh, Jeremy's like, I'm throwing a Star Trek in there.
My mom will be happy with that one.
Well, it was Star Wars yesterday.
That's true.
That's right. It was May the 4th yesterday.
It was. Yeah, we're channeling our, our scientific our love for science, right?
Love it. Love it.
So tell us about what you're doing for Delfina, why you wanted to be a part of it. You're like I was saying, you're a co-founder. Obviously, you're invested into it, and really, what does Delfina do for pregnant women, their doctors, and the community at large?
Great, loaded question.
Big question. So many.
Yeah. So I started out with a background in research, so that's where the science comes in. So I have a PhD in biostatistics, and now the question is, what is biostatistics? So biostatistics is statistics applied to public health. So I really, during my PhD, focused on learning all about fun statistical methods, mainly to analyze electronic health record data. So really messy data, and making sense of it. And I took that and I applied it. I was really interested in just the field of reproductive health, writ large in both the United States. And I was also doing a lot of research in East Africa at that time. So I was working on a big research, not actually a research study, it was a digital health pilot project in Tanzania, using community health workers to deploy digital tools to pregnant people. So using these workers to visit pregnant people in their home and really help them get connected to healthcare services in rural and more urban parts of Tanzania. And so that really excited me because I saw how they were able to just collect so much data through this as a byproduct of the program. And I was excited about using that data to better understand the program, help them improve all these women that they were visiting in their homes, help them improve their health for both themselves and their babies, and then using that data actually to do some predictive modeling to kind of identify which of those women might end up with an adverse outcome or which of those women might need some additional care. So that was kind of my foray into kind of taking the science research side into like actual implementation in digital health. And after that, I was kind of hooked. So I stayed in the kind of area of research. I was a data science fellow at the Harvard Data Science Initiative during my postdoc, doing a lot of different areas of research focused around digital health. That's also when the COVID-19 pandemic started. So again, really interested in using data to figure out how we can understand healthcare utilization, again, in the United States and globally. But by that time, I was starting to get a little, I don't want to say burnt out on the research track, but I was getting a little antsy. I wanted to be able to start building something and actually implementing it and being really involved in that day to day, using science to kind of build a new technology. And that's when I got connected with Sinan, our CEO, who was an MD PhD at Harvard at the time. He was coming kind of from a medical background. He had unfortunately witnessed a stillbirth during his one of his rotations at a hospital at MGH. And so he had this brilliant idea to start using AI and machine learning to actually better predict what patients might develop complications and actually prevent them from occurring. So that's where I kind of came in with the data vision. So we can actually use data to do this, to identify patients and to create a system of care that really is evidence-based. So that's how I got to
Amazing.
and
Also. Yeah.
That's impressive. That was a lot.
Yeah.
Yeah, that's impressive.
Yeah. We always say we get to meet the smartest people on this show too. You're all from like Harvard and Stanford, and it's just wow. Like brilliant. Brilliant.
And going to Tanzania to do it too, that just
Hmm.
adds an extra element of the humanitarian to it, which is nice.
Yeah.
I
I love
think
that.
on the yeah, the it's great that you get to meet people with backgrounds from Harvard and Stanford. I think a lot of people flock there because there is just so much opportunity.
Yeah.
And yeah, I'm really grateful for my time there because I was able to like have some funding to be able to go to other countries and just work on a bunch of different stuff. So
Yeah. I mean,
grateful.
these ideas they need money, right? To
Yeah,
be brought to life. And you put the money together with the smart, innovative minds, and you can get something like Delfina, right? And
yeah,
that's what the show is about, is bringing on the people that are doing just the, I feel like a broken record, like the really cool stuff in healthcare that is changing lives for the better. Like that's what it's about. So
Well, that's what we do here.
yeah. So super, super excited to have you on today. And I want to make sure too, you said public, your focus was in public health. Delphina's really solving for the maternal health crisis. We've covered this in other episodes, most recently with Latham Thomas from Mama Glow with the doulas.
Episode 11 specifically.
Yep, and we interviewed a doula too. The maternal health crisis is a real thing, and to have a company like yours doing something very, very specific and actionable is so huge. What? How does this work? So, tell us kind of how Delphina works for providers, works for the patients. Like, what is kind of the big goal?
yeah, you're absolutely right. So as you already pointed out, and you heard on the previous episodes, there's an ongoing maternal health crisis in both the US and in many other countries. So we're seeing rates of complications like hypertension during pregnancy, diabetes during pregnancy increase. We see NICU admissions, so neonatal intensive care unit admissions for babies increasing year after year. And so there's really a huge opportunity to figure out what's going on and try to kind of correct for it and prevent that from occurring. So what Delfina does is we are a pregnancy care platform. We partner with obstetric care clinics, so clinics that are giving prenatal care to individuals during their pregnancy. So we partner with those care providers to help them identify patients that will go on that might develop complications and then prevent them from occurring. So as part of this platform, we not only integrate within the kind of electronic health records at the system to pull out all of the kind of data insights that we need, but we also have a patient-facing app that supports the patient throughout their pregnancy journey. We also have doulas that connect with the patient throughout their journey, really make sure that they're engaged in their care, that they're getting any other like social and emotional support that they might need. And then we also do have some nutritionists and lactation consultants and mental health specialists on our team that for those patients that need kind of additional support above the doulas and above what they're able to get at their clinics, that they're able to have telehealth consultations with them. So we view Delfina as a system of care and we are proactive. So we're trying to identify people kind of before the complications occur so that we can prevent it from happening.
Like longitudinal pregnancy care.
Yes.
Yeah.
Great.
There you go.
I
Great.
know how
That's quite the phrase.
I know those healthcare words, Jeremy. I've been doing this a
Yes.
while.
Gotcha.
Longitudinal. Great word. Great word.
Yeah.
Exactly. So,
It's kind of end to end, right? It's kind of the fancy way of saying we've got you from, you know,
Beginning to end all the way through.
conception or as soon as you know you're pregnant until, well, really kind of postpartum too, right?
all through. Yeah, we go 1 year like through the postpartum period. And
Mhm.
that's the, I don't know if this was covered on earlier podcast sessions, but what really has always motivated me about like maternal health care, specifically in the United States, is that you have all these prenatal care visits when you're pregnant. You're expected to go to like 10 to 14 visits. And then one after you deliver, you have one postpartum care visit when you know you're trying to recover from this very significant thing that just happened to you. You come in once at like 6 to 10 weeks postpartum, and kind of all the support that you had from the medical system drops off during that period. And that's also when a lot of complications occur. So that's always just been kind of mind blowing to me, that there's just this kind of period of silence with the medical
Yeah.
system once
They're
you're
like,
done.
bye, good luck.
Yeah.
Hope everything works out. It's like, okay. Probably not.
Yeah. Yeah.
Yeah, yeah. A lot of crazy stuff happens. So is Delfina, would you say like your primary audience first the actual OBGYNs and then the patients, or do you kind of can you come at them kind of equally? Like how does that work in terms of your support there?
It's great. Like we think of them both as users of our system. So I
Hmm.
would say everything we do is to improve pregnancy outcomes for moms and babies and their entire families. So that is the central focus. But in order to do that, like we really do have to engage the obstetric care providers that are at these clinics to identify the patients and enroll them in our system of care. So of course, like that is also a key focus for us. But when we started, like initially started building, it was very just like building an app that a patient um, would want to use, that was engaging to them, that had educational material that what yeah could be kind of understandable from a variety of different people from different cultural backgrounds and different areas of education. And that was really what we started with building. And then we also layer in different types of interventions that actually do the that might prevent things like hypertension or preeclampsia during pregnancy. So those interventions again are very patient specific. It's things like taking aspirin, doing some behavioral health counseling. We have like a nutrition program and exercise videos. So those are all very patient focused. But again, to get those to the patient, we really want to make sure that their provider, their doctor is engaged and also excited about Delfina and using Delfina. So we definitely are considering the provider as like a main focus as well.
Got it.
So are you just looking at like biometrics and stuff? How are you doing the like specifically doing the predicting of the bad outcomes? What's that based on?
Yeah, great question. So we are using data that's standardly available in electronic health records. So the reason for that is we wanted to make sure this was scalable. And so I've seen a lot of researchers at like large academic medical centers, so like the Harvards, the Stanfords, doing very complex predictive modeling where they'll use like 1,000 different variables that they have available in their electronic health record. And that's great. That's great if the thing you're building is going to stay within that ecosystem. But the moment you take it out of there, like some other health system functions differently, they might not collect that data, they might store it differently. And so that might not work. So when we first developed our models, we made sure that to keep them relatively simple. So we knew that they could be applicable in most settings. Like when you take it out of a large health system that serves 8,000 pregnancies a year, you can go apply it to a small rural prenatal care clinic that might only serve 500 patients a year. So we use just data available in your electronic health record. And what that means is just for anyone listening, when you go to your doctor, you fill out an intake form that might ask you things about your like family history of hypertension, diabetes, your own prior diagnoses. So that's all information we take in. And then any sort of information on like vitals. So your weight or your blood pressure or heart rate, things that are taken at a standard clinic visit would also be included.
Okay. Are you thinking about Guava Health as she's talking? That was another interview we did recently where they pull in all this data from because it's just the information is so disparate that it's like sitting in all these different
Yeah.
systems. So Delfina does it pull in the relevant data from the various systems and the
Yes.
records?
Yes, exactly. So
Very cool. Oh, I love that. But
That's
just
why
for
you want the
pregnancy.
patients and the providers involved, because then you can get
exactly.
all the records from everywhere compiled.
Exactly. And this, I mean, is a major problem, as you probably heard
Oh
in health,
yeah.
right? Like all of our different data systems, competing EHR systems, like some places don't even use electronic health record EHR systems yet. And so really finding a way to centralize all that information, that's what our team spends a lot of time doing, is like from all these different clinics, how do we pull in information and make it make sense? And then
Mhm.
we also get information from our patient app. And that's kind of we use that almost as a way to kind of fill in the gaps that exist in these EHR systems.
So they're doing for pregnancy what Guava's doing for chronic condition
Yeah.
is basically what
Yeah.
that comes down to in my brain.
Yeah. Well, at least, well,
That's cool.
one part of what you're
That's
doing
cool.
anyway. Yeah,
Yeah.
and you're obviously doing much more than that.
Well, yeah,
And
it expands into other things. Like you were saying, you are making it scalable too. So
yeah.
Right, making
that's
it scalable. It's the base, it is the baseline kind of for everything we do. Like we need the information on the various patients to like be able to figure out what care pathway they should be on, kind of tailor
Mm.
their care pathway based on their kind of prior risk factors. So it does form the basis for everything we do.
And the majority of the patients that are using this, they tend to be like higher risk pregnancies or pregnancies that are or at risk of complication, maybe based on like previous conditions. Like how does that kind of play out?
So we actually all like Delfina is available for all patients,
Could
regardless
be
of
anybody.
anybody.
Okay.
And the platform, by pulling in all this data, collecting data through our patient app as well, is able to then identify the patients that are at risk for certain conditions and
Mhm.
then set them on like a personalized care journey. So if you're at risk for hypertensive disorders of pregnancy, you might get a blood pressure cuff and initiate aspirin. But we're actually not the ones deciding that. We're giving the information back to the care providers so that they can kind of better tailor the interventions for the patients.
So you're like serving it up to them. Like, hey, we did all the legwork for you.
Yeah, here
Now
are
you
all
can.
the insights. And also because the a lot like our patients are using the app, they're entering blood pressure, weights, symptoms, moods. We're also able to show them what the providers, what's happening in between visits. Uh,
Gotcha.
oh yeah, okay. It comes back to kind of another running theme we have here where it's make the most of your 15 minutes with your doctor
Hmm.
because you only get 15 minutes at a time with the actual doctor.
Yeah.
So if you go in there and you got everything ready, it's like, here's what's going on. And he can take just a couple, or he or she can take just a couple minutes to, okay, I see what's going on. Then you can actually use that 15 minutes well instead of just trying to even think of what you're supposed to be talking about.
exactly. And I don't I'm sure others have experienced this too. Like even for the past 10 years of me getting medical care as um I've had to like I had some elevated blood pressure. And so that I actually got a remote blood pressure cuff, took it home, started taking my blood pressure, and my doctor just asked me to write out my blood pressure on a piece of paper, take a picture of it, and like send it to them. So whereas so I'm like showing up to my visit with like a post-it note and
Feel
I'm
like
like,
it's on the back of a napkin.
yeah, like
Yeah.
is there not a better system for this? And I think that it like that really a lot of people are still doing that today, like just
Yeah.
writing things
That
out on
sounds very
paper.
20th century right there.
Right.
They need to update a little bit, I think.
Yeah. Oh my
We have the
gosh.
technology to do it now. Um,
Right.
Yeah.
but it just I don't think like has been disseminated broadly to use like connected blood pressure devices and glucometers and weight scales where the moment you take the measure it just syncs to your electronic health record system for the provider to do. So
Yeah, just dumps it right into the file
yeah,
automatically.
Hmm.
Yeah.
And with wearables nowadays, you've got
Totally have that.
watch, the Aura Ring. I got two. I'm like, I don't even know why I have two, but I do.
You
I've
have
got
two Oura rings?
no, one Aura Ring and an Apple Watch.
Oh, that's fine. It's
She's
good. You
going
can.
cyborg.
I do tell everybody, I'm like, trust me, they track different things. I have them for different reasons. I'm like,
Oh, they
okay.
do. Yeah, that's fine. And then the things that they are similar on, then you can kind of look
Mhm.
and see if they're consistent.
I do actually do that like every day. I'm like, all right, which one's right? They're pretty close though.
Yeah.
I
Okay.
have to,
That's
yeah,
interesting. That was my
yeah,
next question I was going to ask.
they are pretty close. But yeah, it with this kind of brings up an idea in my head, and I thought about too, like really what Delfina is about, and so much of it is about equitable care, and I think that is just something that we need to become more and more aware of. Do you think that there is a shift in just the general like medical profession around we can't I can't deliver care to every woman the same way. Whether it is a cultural background, it is I don't know, like, uh, why can it, ethnic origins, things that might actually be affecting your health as a Black woman or an Asian woman or a white woman or an islander. Like, there's so many different ways of thinking about it.
Yeah,
Is that a big part of what Delfina is kind of thinking about too?
definitely. Definitely. So I'll take us back in history to the to the
Sure.
1930s. Um, so in the 1930s, that was when the first prenatal care guidelines were published. And it said, okay, everyone needs to be on this visit schedule. It's the same one I mentioned earlier, 14 visits at this time point in pregnancy, and then one visit in the postpartum period. That's it. It's one size fits all. Like everyone adopt it and implement it. And that's what's happened like to this day. Like everyone gets the same number of visits. It doesn't matter if you have to drive 2 hours for your OB appointment or you live right next to it. It doesn't matter if you're have no risk factors and you're on your fourth pregnancy versus someone who is extremely high risk and on their first pregnancy, right? So it's just kind of one size fits all approach. And actually, like 2 weeks ago, the American College of Obstetrics and Gynecology, or ACOG, came out with new guidance. So 1930 until 2025, they came out with new guidance, and it's exactly about this tailoring prenatal care. So recognizing that the one size fits all approach doesn't work for everyone, and actually like taking into account not just people's like clinical risk factors, but like their other social determinants of health, and their backgrounds and how far away they might be from seeking care. Like, could a virtual care model work for them? Do they really need to come in for 14 visits? And so this was really exciting that they finally kind of came out and had this recommendation, this new clinical guideline to really say, hey, it's time that we really start tailoring care to individuals. However, people have been doing this for the past like decade. There's been a ton of evidence that you should be considering people's cultural backgrounds when you're giving like dietary recommendations to pregnant people.
Mhm.
Should consider virtual care and doing remote blood pressure monitoring for some individuals, right? And Delphina's been doing that for the past 3 or 4 years since we've been in existence, like doing that tailored personalized care. And there's been other kind of programs at research centers that have also done that. So it's not necessarily new, but now there's enough evidence for this large clinical organization, ACOG, to come out and say, okay, everyone, it's time to adjust.
Yeah, that's good. Yeah, and I think you're right too. Like it kind of happens just to happen, but there was no real like guidelines in place before. So, but people think about it. Well, I mean you have to, right? I mean, I've even thought about when I was pregnant. Like I have epilepsy, and so that was a big deal for me because my triggers were like physical trauma, sickness, things like that. So pregnancy definitely falls in that area, and particularly childbirth itself. So there was always that like extra oversight for me. Now that has nothing to do with my cultural background. That's certainly
Yeah.
my medical, right? But that was probably the biggest thing for me anyway, from like my personal experience was being acknowledged, like, oh, don't let her go into a seizure,
Yeah.
during childbirth. So like every time I had two C-sections, and of course I had to have like that anti-seizure uh, drip in my IV. So,
Were you
but
seeing,
Oh,
we don't need to go into your too much into your medical
oh, I
prep.
love talking about
he
my
does
stuff.
not
I'm just
mind.
I'm just curious if, in addition to like an OB, were you also seeing a maternal and fetal med, like a specialist at that time that was helping, or you were just seeing like your primary OB?
So we could go down a rabbit hole on this one, but this was pre-ACA. That might explain a few things. Do I have to say anything else? There was like very little. Yeah, I was like cash pay because I had no insurance and I was considered a pre-existing condition. And, I had to get like a maternity rider. So I was kind of like bare bones, like whatever I could afford at the time because my husband and I were both
Yeah. Yeah.
self-employed and yeah, I could do a whole episode on my first birth. The second one wasn't as bad, but yeah, it wasn't great. So yay for ACA, by the way. I'm a big fan of these government funded healthcare programs like Medicaid and ACA and all that stuff. So um they help people. So and they help protect us. But I don't want to spend too much time on that.
We will get to that episode.
Yeah, Heather's got to stop from I talking about myself in the third person. Heather needs to stop getting too political on her podcast.
I look forward to that future episode.
It'll be a good one.
It'll be a good one. But yeah, one of the things I want to ask you about too, because I saw the big announcement, you just got a Series A funding round focused on the AI powered maternal. Make sure I'm reading this correctly. 17 million Series A round of funding. Oh my gosh, big deal. So,
What is Series A?
oh, this is startup world talk, Jeremy.
Uh,
Ooh, will I do
Can
it?
you tell us about that? That's like a huge deal.
I don't know
So,
anything about money, so
okay.
Yeah. Also, I always make this joke. I'm a statistician, like I deal with numbers all day, but whenever you put a dollar sign in front of a number, I'm like, I don't do it.
I have a similar problem. Yeah.
Um, so yes, we just raised another round of funding. So in startup lingo, when you're starting a new company, you might decide to look for venture funding, and so you would get your kind of first round of funding. That's called a seed round. The round after that is a Series A, and then
Uh,
I've heard of a Series E, all the way up to that. So at
Mhm.
some point
gotcha.
you might not need more VC money, and so you might stop after Series C and go public or get acquired. But as you keep getting more and more rounds, so it's just indicating another round of funding.
It
So
just it's the funds that came after the initial funds.
exactly,
Okay.
yes, exactly.
Thanks for
So
explaining that.
yeah, it was a new world to me as well. So learned a lot. But yes, it's very exciting. So yeah, so we raised in January, and this is really just going to all of our efforts to scale. So
Okay.
get scaling to more clinics
Mhm.
over the next year and beyond. And really focusing for me, like where my head's at is one, hiring a bunch of amazing data scientists and data engineers to really make sure that we can continue to scale the use of our predictive models and get all of that disparate data talking to each other, and really invest in our data systems, because it's really complicated, as you've already
Mhm.
heard before. So yeah, this is really like, it's super exciting, over
Yeah.
the next.
So scaling, obviously getting into more clinics. So, and you mentioned earlier, I think you have a lot of these bigger clinics, right? That's what they focus on. And then you've got like little mom and pop kind of OBs, like in rural America. I mean, heck, in rural America, sometimes there's hospitals that are shutting down that no longer have maternity wards, right? Or NICUs, or do they even call them maternity wards anymore? I feel like that's such an old term.
We just learned
But
recently we're down to one OB in Flagstaff in the whole city.
yeah, there's one OB in one office, and then there's North Country, which is the FQHC up here.
Oh,
Okay.
that's right. So
They do have them
there's
there.
only one at the actual hospital. That's what it was.
That's a huge problem.
That's huge. Yeah.
But then, you go to Phoenix, right? You go to like a big city, you're gonna have those big clinics there. So, With the scalability, are you kind of do you have like certain areas that you're looking at? Is it just kind of like
Yeah.
how do you move through that?
Yeah, great. So we were like our customers are health plans. And so we work with a lot of Medicaid plans. And so those are mostly like
Oh,
more geographically focused. So where we have most of our clinics right now is actually in Texas.
oh,
And
okay.
so that's great. We're able to have our kind of team on the ground going to clinics, meeting with them, seeing if they would like to use this solution, and really a kind of targeted geographic approach there. Um, and wait, I had one other interesting thing to say that wasn't exact. Oh, because I was excited when well, not excited, but I was when you talked about maternity care deserts. Uh,
Mm-hmm.
that's the formal word for them. The March of Dimes puts out a report every year on maternity care deserts. So I'd be curious to see if Flagstaff now, if things are closing now, like would actually flag as being a desert, or like there's 4 tiers kind of there.
That's an interesting question, actually. Yeah.
Yeah,
Yeah, it wouldn't surprise me. I know somebody who's on the board at March of Dimes here in Arizona. I should
Oh,
give her
there
a
you go.
call.
You really, she
yeah,
knows everybody. That's why she was perfect to start this podcast. Can I ask a little bit of a political question myself? Uh,
sure.
Texas and pregnancy. Is it a
Yes.
weird place to be working with this sort of thing right now?
So I originally, like when we did our first, had the first clinic that we worked with in Texas, that like crossed my my mind as well. But since we've been working at these like like clinics that serve 70% Medicaid patients, they're just like so busy. Like just like I think it's like 15 minutes a patient just kind of going through that they're looking kind of for any support for their pregnant patients. And so I haven't encountered any like really had time to like kind of dive in with the doctors about the like kind of more political landscape there.
Yeah, and the
Um,
legality side of things there now and
yeah.
everything.
And mostly we're like every patient that's enrolled in Delfina Care, like they are entering through our patient app. We have like extreme like data privacy settings. We don't share anyone's data. And so I was a little worried like about that side of things too, like just really making sure that patients feel that their data is protected, especially in this environment. So I think we had a lot of early conversations about that in 2022. Um, and like as a company, kind of coming together to really make sure that patients felt safe using Delfina, and entering data through that to support their pregnancy. So it really honestly has not come up as like a huge a topic with patients or providers in Texas to this day. They're just really looking for help to support their practices, and patients are excited to kind of use our services and have access to the mental health specialists. So
That's
yeah,
Okay.
awesome.
Yeah, that's good. That's good. I'm glad it's not getting in the way.
yeah.
And if I can kind of back up a little bit, and I come from the Medicaid university, I've spent about half my career in Medicaid, currently working in Medicare, but um, I know a lot about Medicaid. Actually, did a lot of work in Texas for a long time. So, so I love that you're there. That's a huge market. But in terms of the health plans, so do you contract first with the health plans before you even go into a market? Like you're not just going like to any OB provider in, any state saying, "Hey, work with Delfina." Are you showing up to their doorstep as a network provider as part of a health plan first?
We won't just go to any clinic. It would mainly be once we've identified a geographic region, like that's where we would basically be going to any prenatal care clinic in that region, though, actually. Like once we're like in this city, we would be going to kind of
Okay.
talk to any providers there.
Mhm.
We are not there on like behalf of the health plan. Um,
Okay.
It's
no,
So,
really
so we
just
aren't
based on
referencing the health plan. No, it's just based on geography.
geographical necessity, basically.
Yes.
The places
Yeah.
that need it, that's where you go first.
Yes. Yes.
Okay.
okay.
That's great. That's a great approach.
Yeah.
Give it to the people who need it the most to begin with, and then work your way from there.
Right.
Yeah.
Right. Like every if we learned so much on the show, and just having worked in Medicaid, Medicare, I've been on the employer benefit side as well, like commercial insurance. So I've kind of seen the whole industry. So everyone comes about it a different way. And like I know that employers are part of your target as well, right? Like can employers bring it on as a benefit for their workforce?
Yes, yes, they can. So
Okay.
it so we've designed so the system was designed to be kind of implemented at within a practice, and patients get enrolled through that way and start using the patient app there. And so that's how we're able to combine all the data insights and render the various prediction models. However, if for employers as well, patients can just download and use our app, and they're able to get access to like educational materials through the app. They're able to talk to doulas. They're still able to attend all of our different classes that we have, like lactation classes. We do like a cooking class, a yoga class. So there's still all of that available, even if the provider's not necessarily like in the loop. So I'm thinking mainly of like employer health plans where everyone's spread out throughout the US, there is still like a lot of value in the Delfina platform. For employers to use, and then employers that are in a geographic region where we can go and enroll the various practices, that's also like a great use of the model as well. So we've made it flexible where there's something that kind of works for every patient and every customer that we have.
Got it. Okay. Yeah, I saw that. I know, like, I saw health plans, I saw employers, you've got the providers, you've got the patients. So you've created kind of
Everyone.
this, yeah, you've
Yeah.
created this great kind of maternal health support ecosystem. Find your way into the door one way or another, you can get in.
Yeah, exactly. Exactly. And I think it goes back to the just being flexible and like understanding that, yeah, not every patient's the same, not every practice is the same, not every provider is the same. And that the other interesting thing for me is when I've seen our system be used at different clinics, that I would think of the clinics as roughly the same, similar patient population, like they're even using the same electronic health record system. But depending on the clinic, like they might have their medical assistants more involved in Delfina. The OBs might be the ones directly reviewing everything, or the MAs might be reviewing some stuff in the Delfina system before. And the way the front desk staff also interact. I've just been really interested in the dynamics of a clinic and then how that all like those different players might interact with Delfina as well.
Got it. And you mentioned too that 70% of or I guess your patients and or providers, I guess that kind of go hand in hand, are on Medicaid.
Yes.
um, which is really interesting. And of course, I'm thinking about this is what happens because all of the people that we bring on the show, like there's all this interconnectedness. That's really cool. I was thinking about Mama Glow, who I mentioned before we actually started recording, who we interviewed Latham Thomas, and we talked a lot about the rising rates of maternal mortality. And she talked especially about Medicaid and lower income and the underserved, which that is your Medicaid population right there. So, what are the providers saying? Are they just like, this is great, like this is changing lives? I mean, even the patients, like what's the word on the street? I imagine this is a big game changer for folks.
Yeah. So again, every practice is kind of, I've been excited to see how differently they're engaging with it and then the different kind of value that's coming out of it for them. So I think one major thing is the support of our doulas to help with the kind of more social aspects of pregnancy. So we do like through our app, we collect a lot of information around social determinants of health. So like looking at like availability of transportation, food insecurity, um, housing instability, things like that, that really help our doulas like tailor their conversations to patients. And that, again, as we mentioned, like there's a 15-minute window that people are getting their visits. So it's nice to kind of have that supplement, making sure that patients are feeling supported and like know how to access other resources. So that's one thing that we've heard. The other piece is about being able to for OBs to be able to see what's happening in between visits. So again, there's those 14 visits, but there's kind of some of them at the beginning are a month apart. And so they don't really, they have to wait for you to come in to bring your little piece of paper with your blood pressure written on it to know what's really going on with you. But with Delfina and other kind of RPM systems, you're able to see like the longitudinal blood pressure measures over time, the symptoms over time, and be able to see what's happening in between those visits. So that's been really exciting to our users as well.
That's really cool.
Yeah, having the real big picture so easily laid out for you, and that definitely sounds like a game changer to me, in my layman's opinion.
Well, and data, data tells us so much. And I'm sure from your perspective, that kind of the scientist, right? The data focused part of you. I mean, I gotta imagine through, and I know you said you're not sharing health data, obviously, but you're looking at what you collect, I imagine, right? And so does it help you start to see trends? Does it help you start to see like hotspots of like issues and like geographically? I don't know if you're that far along yet to be able to get that, but
Yeah. I mean, in addition to the data that we've collected, I also use a lot of national databases,
Mhm.
and because those are great for looking at trends and then kind of isolating the hotspots. And I mentioned this at the beginning, but I've just been shocked by how the rates of all of these like complications are increasing. Like the hypertension during pregnancy has increased twofold over the past decade. Same with gestational
Two,
diabetes. Two,
In
two
10
times.
years.
Yeah.
That's wow.
why? I
Yeah,
wonder.
it's
Like,
a great question. It's a great question. And then I've also at the clinics we work at, like I'll look at their retrospective data, sorry, their historical data to
mhm.
see what the trends look like over time. And it's the same. Like, yeah, it might be 1.8 times or 2.5 times, but it's still in that direction. Like things just across the board seem to be getting worse. I think it's a combination of factors. I think it's definitely has to do with a lot of like social factors like food insecurity, diet, access to healthcare before you get pregnant, because a lot of the patients that we serve get on Medicaid once they become pregnant. So they're not getting healthcare before that. I think it's also potentially like other rates, like rates of type 2 diabetes and chronic hypertension increasing. I have some early um, suspicions that it could be due to pollution, like wildfire smoke. There's been some studies done that showed during those big fires in California, the rate of preterm birth increased, and potentially connected to COVID, like as
Hmm.
a prior infection as a risk factor, because we also see that COVID increases the rates of complications. So I think it's, yeah, a combination of all of those things.
There's, and
Yeah.
so, yeah, you mentioned not having health insurance before you get on Medicaid, where you then qualify for it because you're pregnant.
Yep.
And like I was saying, pre-ACA, right, was my world. And it's a great opportunity to say that, like, we need to take better care of our people. Like, we shouldn't be showing up at the 11th hour, you
Yeah.
know? So,
Yeah, exactly. And this is what I've heard also from our health plan partners is they feel so reactive, like they
hmm
want to be proactive. So they want to be able to prevent these things from happening or know who doesn't have transportation to their medical appointment so that they can get it to them,
right.
or know who experiencing food insecurity so that because health plans do have a lot of resources to connect patients to, but they feel like they're always reactive, like, oh, the baby's in the NICU, okay, now we have to react and try to like improve outcomes from that point. But if the care had started before all of this, maybe you could have prevented that NICU admission.
hmm
So I think that's why health plans are excited about Delfina, because we really like that is our whole thesis is being proactive, um, avoiding being reactive at all costs.
Yeah.
And I think that's where need to go with healthcare across the board,
Oh,
is really
yeah.
focus on prevention instead of like waiting for something bad to happen and then treating someone.
Yep. That is a common thread on our show.
Yeah.
is that kind of getting out ahead of things before they get worse, because historically, health insurance payers were kind of the only, they were kind of the only player in the sandbox, so to speak. And now we've got all this tech enabled these apps, right? Like we're getting diagnostics at home, where the wearables, right? Like all the things and the value-based care, the concept of value-based care, which started around, I want to say around 2010. That's when I got involved in it. And it was kind of like this fledgling like idea. Nobody knew what value-based care meant. Now it's everywhere,
Yeah.
and it is that proactive care. Like, let's stop the bad things from happening by actually taking care of people.
Yeah.
And, well, at least trying to, right? Like, I mean, ultimately, we have to make the decision about what we're willing to do as an individual. But
And it was what about 300 years ago, Ben Franklin said an ounce of prevention is worth a pound of cure.
there you go.
It only took us 300 years to catch up to his thinking
And we're
as a
not there yet,
society.
though.
Yeah,
Maybe.
Yeah,
no.
I guess we're approaching
Yeah.
that, hopefully.
We're getting there. Well, and ironically, so many of these greatest ideas, right? Like the apps and the technology and the AI, it's like everyone was sitting home during COVID going, well, what should I do? I'm gonna build a company,
Yeah.
right? And there's a lot of really cool things, and just pushing everybody to virtual, right?
Yeah.
Like that completely catapulted that stuff too. So there's been a lot of good that has come
That's
out of
why I
that.
got into podcasting.
Yeah, yes. We all found something to do.
Yeah. More
New
podcasts,
hobbies.
more apps.
Yeah. It's true though, actually, podcasting did kind of take off
I
in
was
the
a
last
tour
couple of
guide
years.
before COVID, and as soon as COVID hit, I'm like, well, guess I'm not doing tours
Yeah.
anymore. So I started a podcast.
Pivot, pivot. Exactly. Well, yeah, well, so here we are, and then you've got, Delfina, and you've got, so many other great companies out there that are getting into this proactive kind of
Yeah.
delivery of care, which is amazing. So
Yeah.
I'm excited about it.
That's actually the coolest thing to me about this entire podcast is how much of it is about that. People aren't trying to treat you once you're already sick. It's so much
Yeah.
about not letting you get sick to begin with, if you can. That
Right.
and it makes so much more sense to me that way.
Right.
Yep.
And for pregnancy specifically, it also is just such a short window, when things could go totally fine, but things you could also develop a lot of different complications. And so like you really need to be fast at doing the preventative things to have a healthier pregnancy at the end of it.
Yeah. Yeah, we're here for it. I want to touch base really quickly on the doula piece of what Delphina does. I get like the clinic, you've got all these predictive analytics, the data, these relationships with kind of all the people that are part of, making sure these babies are born healthy and the mom is healthy. Doulas, we know, are a big part of delivery, or the maternal care, kind of that. I think we should have a doula for everything, quite honestly. um we
I
should all
agree
have a
with that.
doula.
I agree with that.
Yeah, just a doula for getting by every day. I think that's called an executive assistant.
Emotional support is what
Emotional
really what it
support.
is, right?
So the doula piece of Delphina, is that virtual?
Yes, so it's virtual doulas, but we hire a doulas from the same like geographic region. And a lot of our patients are also Spanish speaking, so we also have bilingual doulas. So
Okay.
most of our doulas right now, major focus on Texas, going elsewhere now, but like a lot of our doulas live in the Houston and Austin areas where we are,
Mhm.
and kind of represent the patients that we also serve.
And what's your kind of like, I don't know, perspective on doulas being a part of a woman's maternity experience and the actual birthing experience? Because we've talked about this a little bit on a couple other episodes. I already mentioned, I'm a big fan of the doula, and how that has helped actually lower the maternity, or sorry, maternity mortality rate. Am I saying that right? Oh God,
Mm.
it's the
You
end.
got it.
It's the end of the day.
Maternal mortality rate. And
Yeah,
that's we can just
decreasing
yeah,
that, and doula is playing a pretty a critical role in that.
Well, because it's way higher here than any other developed nation.
Right.
yeah, yeah. And also significantly higher among Black moms too.
Hmm.
So I
Right.
think um doulas are amazing. So my perspective is they're amazing.
Mhm.
And
Get one.
also, yeah. And I've also, yeah, studies, there's been a lot of research studies that have shown that they do reduce the incidence of C-section and preterm birth. And then patient satisfaction is significantly higher. And they actually encourage patients. I think there was one study that showed like a pretty big, like maybe like 50% increase in the number of patients that were going to that postpartum care visit that 6 weeks after. So they're still encouraging care utilization with the kind of traditional medical system. So if any other therapy showed that kind of reduction, like positive benefit, it would kind of be everywhere. And so I think
Yeah.
there's a revolution happening now because people are like, whoa, it really does not improve like clinical outcomes for people. And I think a lot of that has to do with, yeah, culturally competent care. I think there's a lot to be said about not being stressed during pregnancy, and they can definitely lower that stress level. They can help you connect you to resources, again, back to like food insecurity or needing transportation. They can help you navigate some of those challenges as well. So I'm all for doulas. I've seen the science as the chief science officer.
Hmm.
I've seen the science, and yeah, I think I'm all for it.
Yeah. That the irony is though is that doulas always were like, oh, it's some like hippy dippy like, crunchy granola mom thing, and it's like, no, no, no. They actually have clinical data supporting the fact that a doula should be a part of your pregnancy and delivery.
Something that's stuck in my brain from Latham Thomas's episodes is 28% reduction in surgical births
Yeah. Yeah. You
just from
mentioned that
having a doula in the room.
the lowering the C-sections.
More than a 28% decrease
That's
in
huge.
C-sections and whatnot.
Yeah. Yeah.
And remember, Latham also told us there is a federal program that if you fill out the right paperwork, you can get a free doula.
Yeah.
You can get your doula paid for through a federal program, and they were already funded before the new administration took over, so they
Yeah.
have the money.
Yeah.
Yeah.
And now you have Delfina too. So
So yeah, keep
even
that.
better.
All those listeners out there who, want to go that route,
Yeah.
find that. I don't know how to find the paperwork, but I know there's a program out there. Go back and listen to episodes 10 and 11. Latham told us all
I'll have
about
to
it.
Google it.
That's that's awesome. And I would also advocate for postpartum doulas as well. So during that postpartum period where you have that kind of care drop off, like having that again support and someone that you can kind of reach out to during the postpartum period um, is also, I think I've seen patients really benefit from it.
Yeah. Oh, I'm sure. Yeah, that's a tough time, right? Like, yeah, you've got everyone, yeah, they're all hanging around you. It's almost like overwhelming, and then you're just alone out there in new mom land saying,
Yeah.
"What do I do?
How does this work?
Sleep when the baby sleeps."
Oh, God.
That never
There's
works.
nothing else to do, right?
Yeah, yeah, that's crazy. Yeah, well, I love this. Has been such a great conversation for us. What is next for Delfina? Like, where are you going? What are the next kind of like big milestones for the company?
Big milestones. So yeah, try scaling. We're moving into other states now, picking up more clinics. I'm really excited we've passed the 5,000 patient mark. I'm excited to start kind of digging into our data more to look at, as you already mentioned, you were reading my mind, like hotspots, geographic hotspots, like because a lot of the national data I mentioned comes out like 2 years late. So you're always kind of behind.
Mm,
So I'm excited to start being able to kind of come up with those own trends with our data. And really looking forward to kind of emphasizing the impact of Delfina and like digging into even like specific, like here's how we're seeing the doulas drive change in outcomes. I'm sure it'll echo other sentiments. Here's how we're seeing our like nutrition intervention look at changes in outcomes. So I'm just excited to be getting to the point where we have enough data to really show the value of the specific components of Delfina, which I think like also just helps everyone that's working in the space, doing research in the space, people trying to make their own maternal health programs, OBs, like trying to figure out what works in my clinic, that they could also kind of take evidence that's being generated by us and by other researchers to implement things that work.
yeah, that's exciting. Lots of stuff. I mean, the world is kind of your oyster. I mean, I think about when I was pregnant, the last time I was pregnant was 2013, and then before that was 2008, 2009. And it's amazing how far we've come. And that, gosh, if I asked my mom, who's 83, she'd probably be like, "Whoa." Imagine what it was like delivering a baby in the 70s
Yeah.
compared to like
Uh,
2009. And I'm like, wow. And I think it's just we've gone light years ahead in a really short amount of time.
Yeah.
So, very cool. Delphine I think, is definitely playing a big part in that. So, advancing our technology and how we take care of ourselves. So, exciting,
it,
exciting stuff.
it's very Mr. Spock.
Oh yeah, back to that. Hey, that's a very nice
Back.
bookend there,
I
Jeremy.
like to
Love
go
it.
full circle.
Yeah, he does. So before we let you go, what is the best way for someone to find you, whether they're a provider or a patient or a health plan or an employer?
Yeah, you can reach out to us at by email. Partner@delfina.com would be a great email to reach us at. We're also on TikTok, Instagram, X, and LinkedIn. And I am personally on LinkedIn and Blue Sky. So I
Great.
post a lot of scientific findings related to the stuff we're doing, but then other exciting things in the field of reproductive health there. And because we are scaling, we are also hiring. So definitely go to our website and look at the careers page. I'm sure we will still be hiring whenever this airs.
I love it. Yeah, I always say hashtag startup life. If you want to work in healthcare, I say, and I've been in healthcare for, oh God, since 2002. I don't even know. Is it 23 years? I, I am not a scientist, so my math is poor. But 20 some odd years, and I will say right now is the most exciting time to work in the healthcare industry. So for anyone that is looking for a career change or just getting in, starting their careers, like get into healthcare, get into a startup. It's super exciting. I love it. So yeah,
I
come along
agree.
for the ride.
I agree. It's been so much fun.
Yeah.
Yeah, I've learned so much in the past 3 years. So I agree with that statement.
Yeah. Yeah. It's a whirlwind, but strap in, buckle up, the whole thing. But it's like riding the crest of the wave, and it's a really, really cool wave to be riding. So that's my take.
That's why I jumped in.
Yeah. So, well, with that, thank you, Izzy, so much for coming on. This has been another great conversation, and just we really love digging into the women's health space, and definitely the maternal pregnancy, all that kind of stuff is definitely a big space for us to be talking about. So, a lot of big things happening. So, we're
Yeah.
here for it.
Thank you for having me. I'm here for it too.
Awesome.
Yeah, it was great to chat with you both. Thanks so much.
And there you go, our conversation with Izzy from Delfina. And it does officially keep getting smarter around here. Uh, she could be my Mr. Spock any day.
Well, she's certainly smart
Did
enough.
that make sense? Was that too suggestive? I don't know. I didn't mean anything by it. So, what are our main takeaways from that, Heather?
So, like as I said at the top of this, maternal health. There we have a maternal health crisis in America. A first world or no.
First world.
I do not
Supposedly.
I do not have a PhD clearly.
Supposedly first
Yeah.
world country.
Supposedly and it can literally continues to amaze me because this keeps coming up on the show that we have pretty significant issues around maternal health and outcomes and the health and delivery outcomes of babies and mothers and all these things. I mean, I'm glad that companies like Delfina exist for
Mhm.
like solving for this issue, but it's still like bonkers, right? Just
Bonkers.
to me that we have these problems to begin with. Like we should be better.
Yeah.
Why are we not better, guys?
Yeah. I mean, it's a question for so many facets of our society these days, honestly. But,
Yeah.
uh, women's rights and especially women's rights when it comes to healthcare and just the focus, the lack of focus, I should say, on women's healthcare for forever before now.
Yeah. Another common topic.
And the fact that all these great innovations that we're covering on this podcast that are now finally addressing women's health in a proper way, who's bringing it to us? It's all women. All our guests are women who are starting these companies.
I am woman, hear me roar.
You know, if no one's going to do for you, you got to do for yourself.
That's what my sign said actually at the women's march protest, by the way, when I did my first one. It did. It actually said, I am woman, hear me roar. So instead we have a...
You're such a hippie.
I'm such a hippie. So instead I have this podcast now, and I like to give the platform to all of the ladies saving the day. Also, another thing, I love that Delfina has doula support, and that doulas is making an appearance again. We've done a couple of episodes around doulas and midwives. Doulas can save the world, guys.
They seem to be becoming more ubiquitous throughout the pregnancy world, or whatever you want to call it. I hadn't even heard of doulas before, but now it's like every time we talk to somebody who's in the pregnancy realm,
doulas,
that word comes up. So that's pretty cool. Yep.
Instead of saying there's an app for that, we should be saying there's a doula for that.
Yeah. And there's the other doulas too, like the infertility doula and the death doula, and we're hearing of these other applications of it as well. We're going to have to get into at some point.
We all need a doula for everything. So I'm stoked that they have that as part of the program. So there's the technology piece, right? Like there's like these predictive algorithms and the AI and the technology, but then there's like, and you also have access to like a virtual doula essentially, which is, amazing, because technology is great. We all want it. We need it. It's making healthcare more consumer friendly. It's making us have more control over our healthcare. But that in person, that human connection is still really, really important. So I think that's a really nice balance that they're bringing. And also too, it is I would say it's a provider first platform, but is also very much for the patient. So I think that's a really, because often what you find is that these new technologies in healthcare are typically built for primarily one audience, but I'm seeing more and more that they're built for not just the provider, not just the patient, but for both. And so that's a really great way, especially if when you're pregnant, if you get diagnosed with like, I don't know, like pre-eclampsia or like one of these things that can be very dangerous, to be able to have an app to track everything and what's going on. And when you walk into your doctor's office and your OB is seeing what you're tracking, it not only helps you, it helps them. And so it's just this whole idea of like
it's expediting the entire healthcare process.
Right. Because we only have 15 minutes with our doctor. So
isn't that fun?
Let's make it efficient, So anyway, I think it's great. And clearly we have a maternity health crisis in this country that needs addressing, and Delfina is just doing their, playing their part. So happy to have them on.
The only so-called first world nation that doesn't have socialized medicine.
Yeah.
And supposedly the richest country in the world at the same time. So explain that to me.
Houston, we have a problem.
Yeah, big problem.
Anyway, we're here to shine a light on those problems, and
let's start fixing it.
Yep, and show you the way to the solution.
That's why it's called an uprising.
That's right. Let's go.
All right. Well, if you like what you hear, hit the like, subscribe, auto download, all those sorts of things on whatever platform you're on. If you have a minute, maybe leave us a rating and review. That's always most helpful for the feedback and the algorithm and all kinds of things. We are on all the major listening platforms, audio wise. We are on YouTube, video wise. We got a Patreon that is also a video platform. You can join the community, support the podcast for as little as $1 a month. What else we got to tell them here, Heather?
You can visit us online at healthcareuprising.com. And also, if you are out there on the socials, you can find us on just about every platform: Facebook, Instagram, LinkedIn, and Blue Sky.
We don't do the X, though.
Nope, we don't do that. We're Blue Skyers. And is that I don't even know if that's how you call it, but that's what I'm saying.
It made sense to me.
Cool. So go find us out there. Just search Healthcare Uprising Podcast and you will find us. We post out there regularly. When our episodes are dropping, we share our interviewees posts. So lots of good information to stay up to date on healthcare. Also, we're always looking for people to come on the show. People from actual organizations, companies, startup founders, etc. And also for our Human Stories series, just regular Joe and Joanna's on the street. However you identify, if you have a healthcare story, we would love to hear from you. So give us a shout at healthcareuprising@gmail.com and reach out, and we'd love to bring you on the show. So I believe that's all I've got. So with that, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.
Shut up!